The high death toll due to COVID-19 in Malaysia lately has caused the National Institute of Forensic Medicine to face a bitter situation when experiencing backlogs in the management of the bodies, as a result of the outbreak and non-COVID-19 death cases. In contrast to the management of bodies of non-COVID-19 patients, the COVID-19 deaths need to be managed with the utmost care by the frontliners, and expedited for burial or cremation. Kuala Lumpur Hospital forensic pathologist Dr Salmah Arshad said that the existing space in the IPFN morgue was not sufficient, and the victims were now placed in containers which were turned into makeshift morgues that could store 12 to 20 bodies of COVID-19 patients. She said that the IPFN morgue can store up to 36 bodies, but there were additional spaces for this purpose, including the Tunku Azizah Hospital, Tuanku Mizan Armed Forces Hospital and the National Cancer Institute. There are 52 coffins, and backup containers to store the bodies. According to Dr Salmah, for the remains of non-Muslims, the next of kin can choose whether the body is to be buried or cremated, and each cremation process takes between 2 and 3 hours, compared with non-COVID-19 cases, which take 45 minutes to an hour. The 41-year-old specialist doctor, who has been in the forensic field for 13 years, said that the increase in the number of brought-in dead cases due to the outbreak was increasingly worrying. She said that during the first wave of the pandemic, the death rate of COVID-19 outside the ward was only 1 or 2 cases a month, compared with now which reached 3 or 4 such cases daily. She did not rule out the possibility that mutations and variants in the virus contributed to changes in the categories of victims, including young people with no history of health problems. On the post-mortem process involving the case of BID COVID-19 or suspected COVID-19, Dr Salmah, who started working at HKL early last year, said that the CT scanning method was used to reduce the risk of infection to staff on duty. The method is to detect the condition of the lungs and other organs of the deceased, such as lung infection or pneumonia, without conducting a regular autopsy. Meanwhile, HKL IPFN Assistant Medical Officer Hisham Mohammed Norden explained that the COVID-19 cremation process time doubled from normal as 2 layers of body bags made of thick, high-density plastic were used. After nearly 4 years serving in the forensic department, Hisham, who was responsible for managing bodies, said that should a person die as a result of the outbreak, there would be no immediate family members to pay their last respects to the deceased, as in most cases they were under follow-up quarantine. said that the public should assist all frontliners, not only from the forensic department but also in hospital wards, and especially in the intensive care unit, by complying with the SOPs and applying self-discipline. To follow the interview with Dr Salmah and find out about the management of the remains of COVID-19 patients, watch the second part of the documentary, Gelambang Kembali, Bilikan Berakir, produced by Bernama TV, to be broadcast on Friday at 8:30 p.m. Article type. Metered user type. Anonymous web user status. Campaign ID. 46 CXence type. Free user access status. 3.